Thank you, Adam. We'll see you again in sports. You can call it the changing face of emergency medical care. We're seeing more and more ERs expanding across the country to include better treatment for people for mental health and addiction. Buffalo is now joining this trend as ECMC gets ready to begin construction on its nearly $60 million expansion of its emergency department. 200 Sides Ron Plants looks at the changes coming to ECMC.
When we have our busy days, I'll frequently see 12 overdoses during one shift.
That demand stemming from opioid use is coupled with the ever-increasing tide of patients, which ECMC's ER must handle each year. The plan to more than double their space, matching patient visits, which soared from 35,000 a year when the last renovation occurred in the 1990s, up to about 70,000 in 2016. And as new ER technology like ultrasound and CT scanners jam available space, some patients are kept in hallways or other spaces until an exam room opens up.
It's really led to sometimes delays in patient care when there's waiting times that exceed what we would really like them to be.
Obviously, patients dealing with substance abuse present different challenges in the ER.
The patients that hit the emergency department, oftentimes we may be their only interaction to healthcare. So we take the time that we have with those patients very seriously.
That now means immediate use in the ER of addiction treatment medication and connections with treatment facilities, but they're complex cases.
Going through withdrawal, looking for help with their addiction. We have counselors in our department who specialize in chemical dependency counseling and assess those patients with us. But again, I think that right now we're in a situation where we're not able to provide the space for those patients to have really privacy.
More private rooms will be in the floor plan for such needs. Then there's mental health issues with the CPEP, the Comprehensive Psychiatric Emergency Program based in the adjacent Behavioral Health Center.
In our new space, we're going to have a much more direct link to the CPEP space with an area to triage those patients, make sure they're safe.
The expansion should be complete by the end of next year. Ron Plants, Channel 2 News.